Now, you do not want to wait till you are thirsty before you drink water, because water plays a very important role in your body as far as your kidneys are concerned, and you don't want to get dehydrated at any point in time, not at all. This is Health Point Show. If you are a returning subscriber, thank you so much for returning back to this channel. If you are new to this channel, thank you so much for stopping by. Please don't forget to like, subscribe, comment, and share this channel for others to benefit. In today's edition of Health Point Show, we continue our series on chronic kidney disease. Chronic kidney disease is a condition where the kidneys are damaged and can no longer filter blood properly. When this happens, excess fluid and waste from the blood remain in the body and can cause other health problems. Now, when this happens and you have chronic kidney disease, the only solution is kidney dialysis, which is an artificial method that is used to filter your blood of waste and fluid. And in some people, they might need it 3 days a week, some may need it 4 days a week, depending on the condition. The average cost of kidney dialysis in the US is about $89,000 per patient per year. And if you have kidney failure, that is, if both kidneys are no longer working, you may need a kidney transplant. And it costs about $400,000 for the procedure and post-transplant care. However, there is a lot that you can do to avoid kidney problems and save this kind of money. Stick and stay with me to the end, and I'll show you how. Now, the first thing that you can do in order to avoid kidney problems and save yourself millions of dollars is to reduce high blood pressure. Now, hypertension is one of the biggest cause of chronic kidney disease and kidney failure. So if you have hypertension, it is very important that you check it regularly and make sure that it is under control. You have to talk to your doctor about some medications that may harm your kidneys. Some medications are there because of their mechanism of action, they might end up harming your kidneys. So talk to your doctor, talk to your pharmacist about other ways of reducing your pressure in order to save your kidneys and save yourself some money. The second biggest cause of chronic kidney disease or kidney failure is diabetes. So if you have diabetes, it is very important that you meet your blood sugar target as often as you can. You need to do a test that is called hemoglobin A1C test. This is a blood test that measures your average blood sugar level over the past 3 months. And it is used to diagnose diabetes and monitor diabetes and pre-diabetes. This helps you to know how well you are managing your diabetes. If you do this test, you get to know how you are managing your diabetes and know whether you are at risk of getting kidney failure or not. So at least you do it twice a year. Ideally, it's supposed to be done 4 times in a year, but if you can do twice a year, it will help you to know your kidney status. Moreover, if you want to save money now and in the future, alcohol should not be your friend. Yes, you heard me right. Alcohol is one of the biggest enemy of the kidney. If you drink alcohol, excessive amount of alcohol can cause your blood pressure and cholesterol levels to rise to unhealthy levels. Your blood pressure is going to rise, your cholesterol level is going to rise, and alcohol can also increase your risk of blood pressure. And if you have blood pressure, automatically you are at risk of getting kidney problems. And if you have kidney problems, you're going to spend so much money on dialysis and kidney transplants in the future if you do not take care. The next thing that you can do to prevent chronic kidney disease or kidney failure is to avoid the abuse and misuse of over-the-counter medications or OTC. For example, some painkillers. Chronic kidney disease can be caused by taking too many non-steroidal anti-inflammatory drugs, NSAIDs. For instance, ibuprofen, aspirin, and some medications, some painkillers, when you take them too much, you can have issues with your kidneys over a long period of time. If you need to take any painkiller at all, you have to go according to the instruction that have been written on it, or the instruction that have been given to you by your pharmacist or your doctor. If you take according to the instruction and you still don't get relief from your pain, don't take more than you've been asked to. Talk to your pharmacist, talk to your doctor, let them know that you've taken as you've been instructed, but the pain persists and they will know what to do. Are you aware that being active can help prevent and manage chronic kidney disease, diabetes, hypertension, and even heart disease? Yes, I mean exercise. So exercise is very important. It is very important that you get an activity that helps you to exercise your whole body. You don't have to do like so many exercise at one time. At least start very small and get moving, such as cycling, fast walking. Every week, it is recommended that you exercise at least 2 days in a week or more days in a week. The one that works all the major muscles of your body, like your leg, your arm, your hips, your back, your abdomen, your chest, your shoulders, and your neck. Don't only exercise only your head or exercise only your legs, and that is it. One that will help you to exercise all your muscles, the one that works best for you. It is very recommended that at least 2 times or more a week is perfect. Also, in order to prevent kidney failure, it is very important to avoid the intake of salty foods. Those with kidney failure should avoid excessive salt intake, as the condition can make getting rid of sodium from the body difficult. Now, with kidney disease, the kidney is unable to get rid of electrolytes and water, and sodium is one of the major electrolytes that is excreted by the kidney. And if you have kidney problem, your kidney is not able to get rid of this particular electrolyte, and it can make the condition very worse. Also, salty foods can elevate blood pressure, which can also worsen kidney problems and even make it very uncomfortable during the process of dialysis. Moreover, choosing healthy foods and drink is very important to prevent kidney failure. This is very important way to give your body the fuel that it needs to function properly. So you have to add more fruit and vegetables to your plate, and this helps to keep your body healthy. It gives you a healthy weight, and also is a great way to prevent and manage chronic kidney disease, hypertension, diabetes, and even heart diseases. The next thing that we want to look at is quit smoking. Quitting is one of the best things you can do for your health. Now, nicotine has a way of affecting your heart, which eventually leads to high blood pressure, diabetes, heart disease, and eventually kidney failure. If you have kidney failure, you will need a dialysis. And if both kidneys fail, you will need a kidney transplant, which costs millions of dollars. The only way that you can save this money is to quit smoking. Now, there are programs that are being put in place to help patients to quit smoking. If you are ready to quit smoking, visit the nearest healthcare center and talk to your healthcare provider, and they will help you every step of the way in order to quit smoking. Do you drink water only when you are thirsty? If you are in that category of people who only drink water when they are thirsty, then you are doing your kidneys more harm than good. Now, you do not want to wait till you are thirsty before you drink water, because water plays a very important role in your body as far as your kidneys are concerned, and you don't want to get dehydrated at any point in time, not at all. More than half of your body is made up of water, and all parts of your body need water to work well, and that includes your kidneys. Now, water helps the kidneys to remove waste from your blood in the form of urine. Water also helps the blood vessels to stay open, and then when the blood vessels are open, blood can then pass through the vessels and carry nutrients to your body, to your heart, and of course to your kidneys. If you become dehydrated, that is if you don't drink water on regular basis because you are not thirsty or because you feel that the weather is not hot or something, the blood can no longer get nutrients to your kidneys and to your body. And this can cause severe issues to your kidneys and to other parts of your body. So it is very important to drink enough water when you work, when you exercise, even when you are not thirsty, and especially during hot and humid weather. These and many other actions you can do to save your kidneys as well as millions of dollars. Remember that the early stages of chronic kidney disease do not have signs and symptoms, so you might not know if you have it. The earlier you take action to prevent kidney disease, the better. Thank you so much for watching this video to the end. Please don't forget to like, subscribe, comment, and share this video for others to benefit. See you soon in the next video.